Hello, my name is Courtney McNulty, and I am a Content Solutions Manager with Unbound Medicine. Thank you for joining us today for this webinar on avoiding common diversity, equity, and inclusion traps in nursing education. Our focus will be on incorporating DEI concepts into simulation settings. To explore this topic, we have with us Dr. Grace Norris, a faculty member at Delaware Technical Community College and a member of the Organization for Associate Degree Nursing DEI Committee. Dr. Norris has over 28 years of experience as a registered nurse across various healthcare settings. She earned her doctorate in educational leadership, and her dissertation focused on inclusive nursing curricula. We'll also be joined by Corinn Herrell, a simulation coordinator at Phoenix College Nursing and a certified healthcare simulation educator. Corinn has over 17 years of nursing experience and 11 years of simulation experience as a nursing educator in both the academic and hospital settings. Finally, we have Diane Bradley, who is also a faculty member at Delaware Technical Community College. Diane is a certified nurse educator and certified healthcare simulation educator. With over 38 years as a registered nurse, Diane has been teaching nursing full-time since 2007 and has been involved with simulation since 2009. Today, our nurse educator co-hosts, Corinn and Diane, will be interviewing Dr. Norris. They will be asking questions to uncover common traps and overlooked areas when including DEI concepts in simulations. We look forward to an engaging discussion on this important topic. There will be a live Q&A at the end of the webinar. Simply type your questions in the chat and they will be presented to our panelists. Now I'll hand it over to you, Corinn.
All right, thank you, Courtney, and thank you everyone for joining our OADN Simulation Task Force today to talk about DEI in nursing education and simulation. During today's session, we will be interviewing one of our wonderful OADN DEI committee members, Grace Norris. Thank you for joining us today to explore information about inclusion of DEI concepts in simulation settings. The questions we will be asking in today's interview surround these concepts in the areas of things we tend to fall into as far as traps, and especially when they're not really fully explored. So I'm going to hand it off to Diane for our first question.
Thank you, Corinn. Grace, as our DEI expert here today, how have you seen this topic incorporated into simulation and curriculum overall?
Yes, hi, good morning. Thank you for having me. I really appreciate it. So as we are aware that healthcare disparities has been on the increase, because that's been so in 2023, academia must be intentional in aligning their curricula and students with the client population that they're caring for, they're going to be caring for, with appropriate knowledge and skills in order to meet that increasingly diverse population. So to help this challenge, organizations such as OADN, Organization for Associate Degree Nursing, they have charged and is working to create a platform for nursing programs to incorporate DEI into the curriculum, including simulation. Mm-hmm. So nursing students must develop the ability to recognize cultural diversity, not only recognize it, but integrate the cultural knowledge and act in a cultural appropriate manner. So these skills set enable student nurses to be more effective in initiating nursing assessment and serving as client advocates, right? So simulation can help meet that need with various scenarios that will focus on assessment and including communication with clients from that diverse culture. And that's a method to help students to begin to practice safe nursing in a controlled environment. So the topic of DEI should be intentionally incorporated into all nursing curriculum, including simulation. The curriculum should have a strategic plan in place by reviewing the curriculum, by creating learning objective, and by using inclusive teaching methods and addressing those sensitive relative topics. So currently, there is some representation that I see in simulation. We must remember, though, that effective engagement of DEI cannot be accomplished within an isolated program, right? Such as simulation program. It must be threaded throughout the curriculum and be included in simulation. We need true commitment to DEI for improved outcomes for client, as far as improving those healthcare disparities that I mentioned, to decrease those healthcare disparities, that have honest conversation regarding the impact of things like social determinants of health instead of race, and identifying our own bias by doing a self-reflection and acknowledgement. So I have seen diversity in simulation. I've seen as far as the props being used, but we need more kind of rich scenarios that can speak to culturally competent care, and not only competent care, but culturally care that's filled with humility and respect for that person that you care, that the students will be caring for. So such care with individuals from, for example, the LGBTQ community, or incorporating active learning strategies for behavior changes that the students may come across. So we need to summarize, we need mannequins and props, yes, but we also need active, relevant scenarios that reflect more of our society.
And that's kind of wonderful, and really kind of speaks to really what I was going to ask you next, and that's when we're talking about the trends and things we're doing, because we're all trying, right, to incorporate DEI into our curriculums, really try to get that out there. But my wonder is, as you've been meeting with other people and networking, have you seen a trend where we tend to start focusing on only one or maybe two patient populations versus that whole broader aspect that you've kind of started mentioning already, that there's all of these different patient populations that are included in this concept?
Yes, thank you for that question. So I have seen trends where the focus has been on race, for example, instead of representation of the various population that these students will be exposed to in a healthcare environment. So that when students do encounter a different situation, that they're not accustomed to, they won't get frazzled, right? They're going to get frazzled, but they're not going to get too overwhelmingly frazzled. I find that when that occurs, they honestly don't know what to do. So then, are we then preparing them enough in academia to align, to meet with what the outside world representation is looking like? So they don't know what to do. They become very frazzled. So for example, I had a student that was assigned to care for a transgender client. The student verbalized, oh, well, they came out the room and they were chatty, because they were nervous and scared. I don't know what to say. I don't know how to care for this client. I don't even know what to call them, just unraveling. So the same thing stood when faced with caring for a client with a language barrier too. For another example, I had a student that cared for a client that spoke Creole. And again, she became unraveled because, I can't understand her. I can't take care of this patient. I don't know how to communicate with her. So I say all of that to say scenarios, we need to incorporate scenarios to include artifacts such as things that are included in patient lives, such as artifacts, for example, prayer rugs, right? And other props that include specific culture things that they may use in their home environment as part of their culture. So including these things in simulation in our scenarios when the students are learning, which is supposed to be a safe environment for they go out to care for these clients, will help them better handle these situations when they come about without them losing all focus on how to care. How am I caring? How am I speaking? How am I engaging with this client?
It sounds like you're really addressing our next question too. What recommendations would you have for simulationists to follow for developing scenarios that most closely represent the intended patient population without bias? What can we do as simulists? How can we learn more about this? What can we do?
Yeah. Firstly, I do not believe that we need someone to review the scenario that most closely represent the population, right? We don't always have that luxury, right? We don't always have that luxury to have someone in that area to assign someone to that. However, we can still, as specialists, we can still speak to it with the story, with the scenario. There is a story to discuss. The story must be told. The story is where the engagement piece is going to come in. The story, the students hearing the story of the client, that's what's going to generate the application, the critical thinking, the thought processes. That's what's going to generate what we need them to get from it in order to engage with the client, to improve engagement and to improve the outcome for the client. Because the whole goal of this is to improve client outcome, is to decrease health, to help contribute to decreasing healthcare disparities. So the story must be told. So running the simulation will tell the story. So we have to include the story in the scenario, the different culture, the different biases, the different gender things that's going to happen. It has to be included in the story. We could have props are props, but the story still has to be told. So changing the way that healthcare professionals treat their clients depends on the experience in the classroom. So we have to change the way that the students are engaging in the classroom, in the labs, so that they are more able to care for the client, safety of the client. We need to expose our learners to a more realistic scenarios and the range of, and the many range of people who they will be working with from the moment they begin their studies, right? Again, not only props such as maybe the different shades, the skin tones. Okay, that's fine, and that's wonderful. But again, tell the story, the sexual orientation, the gender identity. When we tell the story, that will help create that representation.
Yeah. And those are great things, right? So I know I tend to do that with my students too. And then, well, what do you do? You don't know. Well, ask your patient, right? However, we all have different levels of comfort and experience, and even just how do we start that conversation, right? Because we have to be able to tell the student, what do you do? Help them work through that. How do we, as the faculty members, then prepare ourselves to be able to address these different topics, right, that are going to come up, whether it's our own biases or how do you address these different patient levels? What would be some recommendations you would have for faculty to prepare themselves to be able to handle those conversations?
Yes, thank you for that question. Well, faculty has to be also comfortable with having those open dialogue conversations necessary. And again, it has to be threaded throughout their curriculum. It has to be threaded during the lectures and labs, and it has to be threaded throughout. It can't just be one piece. And we have to be intentional of ensuring that our curriculum aligns with that by reviewing our curriculum, right? We have to be intentional in providing students with that knowledge and awareness and the skills needed to provide that culturally competent care, that culturally competent environment. This applies to our instructors. It begins with recognizing our own biases, right? So, and we have to recognize our own bias. And again, that aligns with us been intentional of reviewing the curriculum and having meetings to discuss these things, right? To discuss open things, open biases, open topics that speak to bias. So let me give you an example of a student bias, of an assignment that the student realized they had bias. So it's the same way as instructors, we could create some type of self-reflection when we're doing a curriculum review. We could do also a self-reflection of our own biases. So the student, I teach senior level nursing students, and one of the assignments is that they have to do a self-reflection paper with some questions. And one of the questions I created at this block included something that speaks to viewing a situation from a different perspective, right? And this is to help with that inclusiveness, viewing care, viewing the patient from a different perspective. One of the students shared that when, so to answer this question, she wrote on the paperwork, well, I took care of a patient with a gunshot wound. I was assigned to care for a patient with a gunshot wound. And she said she immediately thought that the client was part of a gang. I'm sure that student is not the only one with biases such as that, right? We all have some form of bias, and we should be incorporating a framework such as cultural humility that speaks to that. Cultural humility training for both facilitators and learners, and use of assessment and evaluation strategies, participating in curriculum redesign. And I know most of our curriculums are great, and we're not saying it isn't, it's great, but can it undergo some form of revision to make sure that we are speaking to DEI, right? So participate in curriculum design and having a systematic approach, starting with a full review of the curriculum and then implementing evidence-based content to fill the gap discovered through that assessment process. So we could also identify key DEI concept that should be included in nursing curriculum, such as I mentioned, cultural humility, incorporating healthcare disparities, incorporating social determinants of health. For example, one of the ways I incorporate social determinant of health, for example, when I'm speaking to, for example, chronic kidney disease, there's a formula that goes into estimating an individual kidney damage, right? Based on for example, glomerular filtration rate. They realized race was part of that calculation to figure out that glomerular filtration rate that tells how bad a person's kidney is functioning. What they come to realize is race does not determine that. Race was part of that estimation. What we speak about now, and I speak to, is the social determinant of health part that goes into that, such as, okay, for example, the individual may not have access to fresh fruit and vegetable. They may not have access to adequate for transportation. They may have the environment may be polluted, right? So
Mhm.
we have to look at those social determinants of health as a cause for non-compliance, as a cause for not following up with the doctor.
Mhm.
We also have to assess the current level of faculty understanding and commitment to DEI principle, looking into providing training and professional development resources and enhancing their knowledge and teaching method, and developing a plan. And based on the finding, and develop a plan for incorporating this into the curriculum. Again, this has to be intentional. It can't just be spotty one thing here and spotty one thing there. We have to be intentional in doing it, just like we are intentional of reviewing our curriculum every year. Let's review it for DEI. Let's review it to ensure that the students are getting what they need to care for that diverse population that is growing every year. So we have to put DEI concept into all course. So one of the ways the OADN Organization of Associate Degree Nursing is doing it, again, they have been committed to working. We worked on what we recently finished up and was approved was a toolkit which will be available soon to programs. We already have approval. It's already done. We're just waiting for the official toolkit that's going to be going out to nursing program. And the toolkit aims to provide ADM program and educators and administrators with the resources that's going to be needed to evaluate the current curriculum. And not only evaluate it, but interrogate it, interrogate new content, I should say, to address health inequities and improve the overall faculty and student diversity, equity, and inclusion.
That's amazing. That'll be a great asset for all of us.
Yes.
Yeah, I can't wait
for that kit.
I can't wait till that's available for everyone. This has been wonderful, and we really appreciate Dr. Norris speaking with us and sharing this, giving us guidelines and specific examples of how we can address all these potential barriers to DEI, and that toolkit definitely will be very helpful. We want to thank everyone, and thank you, Corinn, also for being involved. And if anyone has any questions, please let us know. We really appreciate you participating today with us in this seminar.
Thank you, everyone.
Thank you.
Thank you, Dr. Norris, who unfortunately is unable to join us this afternoon for the question and answer portion. But Corinn and Diane led a wonderful conversation, and we did have quite a few questions that came in. The first, which I can address, is that this recording will be made available to all attendees, so you will be receiving a follow-up email with that information. And to get to the important questions for our panelists, the first question we had is, could you please expand on the scenario when the student indicates they cannot understand the patient's language, cannot communicate with them, so then cannot provide care for them? How can the instructor respond to this situation?
Yes, I'm gonna go ahead and jump in on this one. Thank you, Courtney. So what she was talking about was kind of that situation really of any patient we have a language barrier. And typically the easiest way to start talking about this is when we can't communicate with them. Here we like to then start asking the questions, like what resources do we have? So that we can bring awareness to those different things. So we have in my state, Mountain, Arizona, we have a very high Spanish speaking population. So a lot of our facilities have Spanish interpreters in the building. So we would need to call our Spanish interpreters to come be with us to have that conversation with the patients. Or most of us have those phones, so that I might be dating myself just a little bit, where we have the two phones with the more languages available. And then of course there's VRI, video remote interpreting service. So we here start talking about those different types of interventions to get the students to really think about what we do and is the family member the most reliable back and forth, because we do see that a lot where families want to be the interpreter, but really what could come up with that and bring this thoughts of what could happen. So you're going to say one thing, but that's upsetting. Is the family going to tell the patient that? So we try to have those kind of dialogue conversations when we're discussing these different barriers.
I also think it's important to talk to the student in private and ask them exactly why they feel like they can't communicate with this patient and care for this patient. What is it that they're feeling? What is their barrier? Help them identify that and explore that and get a better understanding of where they're coming from. Is it just the language, or is there more to it that you can help and explain, the role of the nurse and go through the ethics of, caring for everyone, and explore what's making them feel a little uncomfortable, so that the next time they care for someone that is culturally different than them, that they'll have a better idea of how to address that. So.
Thank you both. That was wonderful. And I think that leads well into our next question, which goes to the toolkit that Dr. Norris mentioned, so that maybe things like this can be addressed and faculty can be prepared.
The toolkit is out there now. There was an announcement from OADN and sent out to everyone. The toolkit is available. It just became available I think it was last week, the end of the week. So that's pretty exciting. I recommend that everyone go to the website and take advantage of looking at that toolkit and using it within their programs.
Well, that's wonderful timing and very exciting. And again, that is the Organization for Associate Degree Nursing, so OADN. And we will provide some information on how to access that in our follow-up email as well. The last question we have, which we have time for, but I think that it will go well to addressing the toolkit also, is what can you do if you would like to update DEI elements of a program's curriculum, but all faculty members are not on board? Save the hardest for last. They're all equally as beneficial.
That one is always interesting. I know we've recently gone through and we tried to make broad adjustments with the typographics, so changing some of those words from, maybe a very specific group to a more inclusive, just the we talked about some of those discussions of changing some of the wording. So that's a little more broad. I'm not doing there's gonna be a lot in the toolkit for you guys on that one when there is none of it as cohesive of a unit in your group. You can get what you can do in your class. We have control over that. Hopefully, maybe giving them more education or giving them access to it, because it could just be that those that are not maybe embracing it or don't seem like they're embracing it, and they don't know how to have that or what to do, so they're afraid of changing some of those terms or including a different component with that course because they're not as knowledgeable either. So that could be why.
I agree with you, Corinn. I think the education piece is key. I think of, a patient who doesn't want to take their medication. What's the first thing we do is we educate them of the importance of the medication. I think it's important that everyone understands what DEI is, what it includes, because not everybody does, and they only see one piece of it. And like you said, it's such a broad topic that we just need to explain more of what it is, explain the reason why it's so important and why there's a focus on it nationally right now, and go into that, it's that awareness, the implicit bias that people have. They don't really even know that they have that. So give examples to the faculty, have them do different activities to see what bias maybe they have and they may not even be aware of. The more education, the better, I think. At our college, it's required, and it is a focus now. I think nationally it's a focus too with a lot of organizations.
That was wonderful. Thank you both so very much. We are at the end of our time, so I want to thank everyone for joining us today, whether morning, afternoon, wherever you are joining us from. Please keep an eye out for the email follow-up with the recording and information on the OADN toolkit. And a huge thank you to Corinn and Diane, and of course, Dr. Norris, for going through this complicated and very important topic with us this afternoon. So I hope everyone enjoys their day, and we will hopefully see you back here again soon.